Everyone, and welcome to the HDR UK Wales webinar. So this is a Connecting Expertise webinar, which really is all about trying to give better visibility to information that people might find useful. And this one's about cardiovascular research, and also help you to put some faces to names and feel a bit more able to reach out to each other. It's easier, isn't it, once you've seen somebody on an event. I'm Emma Rees, and I've been asked to chair this event. It's quite informal, so my role is really just to keep things going and to help the questions and discussion a little bit later on. My job is I'm an Associate Professor of Healthcare Science at Swansea Uni, and my research area is early diagnosis of heart failure and improved pathways for heart failure. We've got 4 really good speakers, some nice talks lined up for you to hear today. So the first 3 are going to be from colleagues at the British Heart Foundation Data Science Centre. So we're going to start with a bit of an introduction and then drill down into a little bit more detail. And then the 4th speaker's from the National Cardiovascular Research Network here in Wales. So I think across the 4 talks, you're going to get a really good idea of what's going on in cardiovascular data research, and some insights into how you might want to take ideas further or catch up with other people. The format's going to be, we will have the speakers have been asked to talk for about 10 minutes, and we're going to go through all 4 of the talks in order before we open to a big discussion, because obviously it's all on a similar topic. So questions you have might be answered by somebody else. So please make use of the chat during this. You can start putting questions in there if you want, especially if you're worried you're going to forget them by the end. But also in the chat, it would be nice to get a sense of who you are, what you're interested in, where you're based, because that allows other people to be able to catch up with you then if they want to. You'll have seen that this session is being recorded, so just be cognizant of the fact that it's being recorded, and the team will let you know where that recording is going to be, I guess, if you ask for it later. Okay, so I'm not going to talk for any longer because the important thing is obviously to get on with this information sharing. So I'm going to ask Jessica Farrow to speak first. So as I said, Jessica's from the British Heart Foundation Data Science Centre. I think you're the communications lead, are you, Jessica?
Yeah, that's right.
Brilliant. So I think you're going to start by giving us an overview. Do you want to start by sharing your slides, and we'll let you know that we can see them and everything else?
Yes, no problems. Let me get them in the view that I need. Now, I can't see any of you, so I'm just gonna crack on if that's all right.
That's great. Just before you start, can I ask everyone to make sure they're muted while the speakers are talking, please? Thank you. Over.
Thanks, Emma. Yeah, so hi everyone, my name's Jess. I'm the Communications Manager for the BHF Data Science Centre. I'm going to give you the speediest of speedy overviews about the centre and our work before you can get into the really good stuff from Ross and Zach later on. So a little bit about what we do. We support data-led research to improve heart and circulatory health. We want to be the UK Centre of Expertise for enabling cardiovascular data science. We build strong partnerships to improve health data science infrastructure, which reduces barriers for research. So we've got relationships with data custodians all around the UK, including Sale at Swansea. We've done a lot of work in kind of unlocking and streamlining access to linked health data, including electronic health records in secure data environments across the UK. Our health data science team provide bespoke support with tools and advice, and you'll hear a bit later from Zach about what's going on in Cell Data Bank. We've supported around 100 projects so far on COVID-related research, with papers coming out all the time. We also involve patients in the public in everything that we do, and this is important for building trust about our work and also ensuring that our work is relevant, important, and meets their needs. So we've got a group, a public advisory group of people who live with or are affected by cardiovascular and circulatory conditions, and they work to help us with project approvals, setting research priorities, communications, and much more. Lots of you will know already that we've recently had our funding renewed for 5 more years to the tune of £10 million from the BHF. This is really, really great news for us and everybody that we work with. But it's also an opportunity for us to redefine our vision, and we're moving to a more kind of service-based model. We're currently working through this in a kind of 6-month transition period. So our new vision, as you can see here on the slide, it's to improve heart and cardiovascular health through the power of large-scale data and advanced analytics by assembling UK-wide infrastructure and services. So we really want to deliver research user-led data services, which are focused on these 2 major objectives that you can see on the slide here. So efficiency, which entails faster and easier trustworthy data use for all cardiovascular researchers, and also really improving the quality, so enabling better cardiovascular research with better data. So this kind of we've kind of drilled this down into kind of 4 themes based on those 2 objectives here. So the first one is about data access services with cardiovascular disease driven priorities. And we've got some new data priorities, which is like whole population data, which is kind of carried over from our previous work with the CVD Covered UK COVID Impact Programme. We're also working with priority data partnerships, which includes partners like Sale and Swansea and also NHS England. And we want to develop a new user portal for cardiovascular researchers who want to use our services. And then below that is kind of linked to governance, trust and transparency services, so information governance advice, public involvement, and also kind of advocacy and community. So building our cardiovascular community, communications fits in under that. We also want, under the quality theme, is to kind of improve our data utility and linkage services, which you'll hear a bit with the training and guidance section there. You'll hear a bit from Zach about the kind of resources that will be available, data availability advice, linkage platforms, which includes UK Click, which Ross is going to talk about later on. And then the last theme is about data engineering services. Again, Zach, I think, is going to talk a little bit about that with curation and engineering services, phenotyping work, and then support with analysis. The kind of new data priorities, which I kind of alluded to earlier on, we've talked about the whole population data and the clinical cohorts, which UK Click falls under. We also want to do a bit more work around kind of local and regional data, which will give us kind of more granular information than what we've had from whole population data before. And we also want to expand the kind of multimodal data with cardiovascular imaging data. So with that, we are working through this transition as we kind of develop these new services. So it'd be great if you want to keep in touch. I'll put 2 QR codes here and I'll put links in the chat later on. If you want to follow us on LinkedIn, we're always sharing stuff that's going on, how to get involved, how to work with us. And we also have a quarterly newsletter, so please feel free to sign up to that. It's for kind of more general interest, opportunities, what's going on. So with that, I will stop sharing and hand straight over to Ross.
Brilliant. Thanks, Jess. Can I just get a quick thumbs up that you can see my slides okay? Perfect. So yeah, nice to meet you all. My name's Ross Forsyth. I'm the Service Development Manager at the British Heart Foundation Data Science Centre. And yeah, I really wanted to give you an overview of one of our kind of new flagship services, which is UK Clinical Cohorts Trusted Research Environment, which you'll hear being referred to as UK Click as we go. So just to give you an overview of what I'll talk through, I'll give you a background to UK Click, what it came about from, why we thought it was a good idea, and just some of the community that we've been working with to develop the TRE. I'll talk about the infrastructure, some of the onboarding process and what data sets we have available, and hopefully leave you with a nice summary of the benefits of using UK Click. So I guess just to zoom out a little bit, when we talk about cohort studies, what is it exactly that we're talking about? So I guess across the UK, there's hundreds, potentially thousands of clinical cohorts that are all gathering data on a whole raft of diseases. In the cardiovascular world, we usually look at heart disease, stroke, heart failure, diabetes, other related cardiovascular conditions like kidney disease. But essentially, it's a group of people that are taking part in research that have a common, I guess, a common factor. In our world, it's usually some kind of cardiovascular disease. I guess the ultimate aim of those research studies is to further understanding of these conditions and identify mechanisms to prevent or reduce the burden of these conditions. Generally in cohort data, it'll be really rich. They'll be captured within a specific time frame, and it can gather a whole range of information about the participants that are taking part in that study. I guess cohorts that we work with, it can be an expensive process to gather this data. It's not unusual for the cohorts that we work with to spend £5 million on collecting data over 5 years. And having worked on cohort studies myself previously, I know the blood, sweat and tears that go into gathering this data. You can have lots of sites across the UK, lots of effort from lots of people goes into gathering this data. And I guess what we found was that when you're working with those cohorts, although we get really rich data at that middle box where there's complications, or if somebody goes into hospital with a condition, they'll be engaged with a cohort study. But what we found was that the linkage process and the ability to look backwards and forwards in that patient's timelines was often really difficult. So what we found was that the cohort data itself was really rich, but that could really be enhanced by linking to NHS health records, for example, to let researchers identify what were the health patterns that led up to that condition and what led up to them being engaged with that cohort. And again, what we generally see is that cohorts will spend 5 years really intensively working with participants, collecting that data. Sometimes their funding runs out and they don't get the chance to go through that linkage process. They might not get the chance to really examine that data to its full potential. And once the cohort study finishes, often you see people move on to other studies or other roles. And unfortunately, that data can sometimes sit in a university hard drive without actually being accessed by other people that could really make some important breakthroughs based on that data. So what we want to do is to offer people a solution to smooth that linkage process. I think at the moment it can take, well, up to 2 years really to fill out a full application process for NHS data, for example. And that really can just be a real limiting factor when it comes to doing this kind of research. And I guess just to summarise how cohorts generally would do their linkage at the moment, for using England as an example, you would have lots of cohorts storing lots of data across lots of universities within the UK, and NHS England would disperse data to those multiple locations with lots of data applications for each of those arrows essentially. And what we're proposing is that we could be a house for UK clinical cohorts to have their data linked en masse, so within one trusted research environment, and to have one linkage application that covers a whole number of cohorts. So our community of cohorts is sitting at around 35 at the moment. So can we house all of those cohorts in one trusted research environment and submit one application to NHS England, for example, for all of those cohorts to be linked? We're also working, I'll come on to the Welsh data in the moment. We are working with SAIL Data Bank at the moment to really facilitate the linkage for Wales, which is something we're really excited about. I guess as well as performing the linkage, we would give the cohort owners themselves access to the data. And once they've done their research, once they've answered their primary research outcomes, we provide a mechanism for third-party researchers to apply for access to that data. And if their application is appropriate and the governance is in place, then third-party researchers can access that enhanced cohort data as well. And again, it really just builds the case for trying to really maximise the use of this important data that's been collected. So I guess the aims are really to help cohort owners, so PIs, essentially to efficiently and affordably link their study data with electronic health records to give them richer, more complete information to support their research. To give each of those cohort owners a secure space to manage their data, we do offer a space within the TRE where data can be collected prior to linkage, and that lets people collect, store and organise their data as they would within their own university. And then really to make that data available to approved researchers within the secure environment, to again open up that data to as many people that can make breakthroughs as possible. I guess just to give you an idea of what the infrastructure looks like, on the left-hand side is what we call our cohort bridge. So that is where cohorts can go in, set up generally a REDCap module or some kind of data entry tool where they can collect their own data. When they're ready and when their data is in a place to be linked, then we work with Digital Health and Care Wales to process their File 1 data and have that linked to NHS data, and then their File 2 would go into the main element of the TRE. So behind this wall is really where the link data would sit, and that's where a lot of the exciting research takes place. On the right-hand side is the SAIL Information Governance Review Panel. So that is the mechanism that those third-party researchers would go through to gain access to the cohort data. And as I say, we did select SAIL Databank to be the TRE provider. After a procurement process, they were really a standout TRE that we've been excited to work with. They have a mechanism already established for people to access this data, and it's really provided us with a really quick solution to allow people to be scrutinised and to check that their research proposal is sound and that they should be able to get access to that data. Just a quick overview of the process that cohorts go through to be onboarded. They would generally send us an inquiry form, and usually there's a few conversations that take place just to make sure that UK Click is a good match for that cohort. If that is a match and it's something that we want to go ahead with, we undertake a consent review for any documents that people have consented to take part in the research study. So that really tries to establish that the use of data is in line with their participants' consent form. So we check that there's consent for the data to be linked to health records, that there's permission for third-party researchers to access the data, and for that data to reside within a TRE. We also have a public advisory group that feed into that review process. So we have lay members that would essentially read the consent form that people have signed up to, and assess, is this something that I would be surprised by if I was a participant? Is it something that I would kind of expect my data to be used this way? And there's a joint decision between our consent review panel and our PAG group to decide if it is appropriate for that cohort to be onboarded. And if it is, then it comes to, well, there's an appeals process if they're rejected, but essentially if they are appropriate for onboarding, then we go through a process of checking costs, checking the data minimisation that needs to take place for the data to be moved on to the trusted research environment. And then the data is linked. The cohort would complete their own IGRP application, so that's to make sure that they can access the NHS records, and they'd be given access to a space in SAIL to access the data. That sounds very linear. It sometimes isn't always as linear as that, and there's lots of cohorts that we have to work with just to really get through those. Really, the consent review process is probably the slowest part to make sure that the use of data is in line with participants' expectations, and I think that's for good reason. We want to make sure that any cohorts that are onboarded are done so in an appropriate way. Just to give you an idea of the scale, as I say, we've got about 35 cohorts that we're working with at the moment to be onboarded to the TRE. So we want to provide a UK-wide solution. I've talked mostly about NHS England data, but as I say, we do have Welsh national data as part of our agreement with SAIL. So that's mostly the patient episode data set for Wales, emergency department data, outpatients, critical care, etc. I guess what we want to do, again, to make things more streamlined, is rather than cohorts having to go to NHS England, to have to go to SAIL and to go to Public Health Scotland to get that UK-wide solution, and the Trusted Broker Service in Northern Ireland, I should say as well, we want to be a one-stop place for those applications all to take place. So it's trying to, again, smooth that process of linkage across the UK. An additional benefit of using UK Click is that you'll get access to support from our health data scientist team. I won't labour this point too much because I know Zach is more capable to give an overview of the kind of curation work and support that they offer, but really just to say that generally when the link data arrives within the TRE, it can be quite messy, and I think what our team is there to do is to help navigate that electronic health record data, so that the cohorts and researchers don't have to do all the data cleaning themselves on day one when they're given access. So that was a quote from the Goldacre reviews, that it's been estimated that 80% of the work for data science with NHS records is spent on data preparation. So what we tried to do is to do that data preparation upstream of researchers accessing the data, again, just to make it a smoother process once they get access. So just to summarise, our current position is that we have a governance framework for the trusted research environment developed. We've got a really enthusiastic group of PPIE contributors that have helped us develop the TRE to this place. We have ethics approval in place and CAG approval, which has helped with our consent review process. We are linked to Welsh data, and we have an NHS England and Public Health Scotland application pending, which we hope to see approved in the next month or so. I guess in the future, a lot of the cohorts that we work with have a lot of multimodal data that they want to work with. So images, CT scans, genomic data, smartphone and wearables data as examples. So we're trying to set up pipelines within the TRE that allows the handling of those kind of specialist data modalities. So that's something that we're working for at the moment. And yeah, I won't labour the point too much, but I really think that this is a really beneficial trusted research environment for cohort data owners across the UK. And if there is anyone out there that wants to talk about potentially onboarding a cohort, we would love to hear from you, and happy to answer any questions that have popped up off the back of that. Thank you.
Thank you, Ross. And we're going to move on now to Zach Welshman. Zach, do you want to share your slides? So I think Zach's going to tell us more about data science tools and a resource generation plan for the SAIL data bank. Over to you, Zach.
Thanks very much. Just want to make sure everyone can see the slides in big mode, or if it's still in little mode.
It hasn't gone into slideshow yet.
There we go. Thanks very much. So I'm Zach Welshman. I'm a health data scientist at the BHF Data Science Centre, and today I'm going to try and tie together what Ross and Jess have talked about, and talk a bit more specifically around curation services for impactful research outputs, and what our plan is for big data for complex disease in the SAIL data bank. So as an outline, I want to build upon the BHF Data Science Centre's previous work, which has improved the usability of electronic healthcare records for research. We want to talk about delivering reusable data curation research methods with the aim to reduce the time to produce academic outputs, and briefly touch on supporting academic fellows and all those involved on data curation methods resulting in long-term benefits for the research community. So just to highlight previous work which has been done, and there are other groups which have done similar data curation work which are not mentioned, but the COVID Impact Consortium has delivered some pretty amazing numbers, and this is as at December last year. So we have some great vanity metrics like publications. So we produced 46 publications at that date. But I think what I really want to highlight in this is the collaboration and the connecting of expertise among over 400 members and 50 institutions, across the UK, and with national TREs. I think the work that was achieved here is excellent, and the data science team which was involved have produced some amazing methods which really should be reused in SEAL and other research and TRE providers. So the team members, who are they? So we used to have a few more members, but they made transfers to other organisations. But briefly, we have Tom and John on the left, who are the senior data scientists leading the team. We have Fiona and myself, Jadine, Anna, Lars, and Laura. And specifically for the Big Data for Complex Disease work, it'll be myself, Fiona, Tom, and John, who will be collaborating extensively with Professor Ashley Akbari and Victoria Best, who I believe is on the call today. So with this in mind, we have work that we've built upon. We have a core team, which will be delivering data curation services. I'll be collaborating with people who have got a lot of expertise from SEAL. So Ross has already shown this slide, so I'll talk about it briefly, but the research journey starts with a proposal. It then gets refined, turned into a data curation plan. This then results in an analysis data set which researchers can use to do their analysis on and apply their algorithms, and ultimately research output. And as has been mentioned, a lot of work and time is spent on the data curation phase. In the proposal phase, there are a list of initial questions that might arise when researchers are trying to understand the data and get it for their research. So the questions are, what data exists? How can I find people with a particular disease or comorbidity? What are the limitations, gotchas, and what is the feasibility of my research? Can it be done? And then typically a bunch of data scientists and experts will get together and they'll ask more questions. So, how is the data collected? Are there any reusable methods that already exist that we can apply to this project? What does the data partially or not capture? And what's the sort of size and coverage of the cohort? And again, to highlight, it's around connecting and collaborating with experts across multiple domains, even at the proposal stage, which is very important. So healthcare professionals, data science, software engineering, and most importantly, the public and patients. So once the proposal has been refined and we have a good idea of what we're trying to deliver for a researcher, we then will get project-specific provision data. So you will see on the screen some abbreviations for key primary and secondary care and mortality data that exists within SEAL. We will then run it through a list of processes and methods to curate the data from its provision format into a state that a researcher can then apply their algorithms on. So we have a list of different processes here. For example, data harmonization would include something as simple as semantics, so ensuring that the names of particular columns in data sets are consistent to allow quicker and more efficient wrangling of the data. However, within this process of wrangling data, as a data scientist, you inevitably come up with new questions and new areas of exploration that were unknown before you started the project. So this is where we start to create reusable code and reusable methods that can be packaged in a way that can be reused amongst different projects. So if we service the needs of one project, we can then reuse that in multiple projects. For example, in curating a BMI method or a method to get cholesterol from the data sets. And it should be noted that SEAL are excellent. They've done a lot of work already on curating different variables from different data sets. So ethnicity and BMI, for example, are two that come to my mind, but I'm sure there are others. And along the journey, we also generate insights about data. So for example, at the bottom of this screen, in the middle, you can see a plot. And all it's showing is the number of patients and records over time of a data set. Now, this is particularly important because it gives a researcher an idea of what is in the data, but it also means over time, as new batches are added and data is refreshed, you can check for data quality issues, which ultimately have a significant impact on the research. So it's important that we do these types of tasks, we carry out this type of work in addition to the curation pipeline. So on the screen, you'll see a more specific list of different assets and reusable code that we might generate. So I mentioned ethnicity. We have lower super output area, so a geographical coverage for patients. Sort of different formats of diagnostic and operations coding, and deaths and vaccinations. So we want to build methods that can be applied to source data that researchers can then reuse in their code, which is a slight difference from creating the data asset itself. We're writing the code and giving it to the researchers to run. So in addition to these assets and different curation variables, we're going to create a template project pipeline. So the idea that a project can take boilerplate code, can drop it into their project area, can tweak some parameters, can pull in data assets, and then give them a research ready data set quicker. It's also quite difficult for researchers, so how are we going to support them? You know, that they have this wide landscape of TREs, data, different environments, and they're sort of expected to learn the tools for all of them if they want to do it, and that's a lot of work. So there are different, lots of different options for researchers for upskilling. And quite luckily, in many cases, a lot of the environments and software that are used are open source. So the software and the documentation does exist for them to use it, but helpfully, organisations like HDR UK have Futures Programme, which curates different types of courses that are helpful, and also SEAL themselves have got courses hosted on data size, which I came across, which help researchers get up to speed quicker to start accessing the data. So just to recap, what we want to do is build upon this work that's been inspired by the BHF Data Science Centre to improve the usability of healthcare records for research. We want to deliver reusable research methods to reduce the time to produce academic outputs. And we want to support these academic fellows on data curation methods so they can benefit long term from the skills that they've developed. So thank you very much for joining. Here's the lovely faces of the teams and collaborators on this project. There's an email address at the bottom if you want to get in touch. And if you can't remember that email address for the team, there's my email address if you want to email me directly.
Great, thank you so much, Zach. That was really helpful. We're going to move on now to our last speaker, Libby Ellins, who's going to talk a little bit about Wales's National Cardiovascular Research Network and all of the connections that involves. Libby, I'm going to move over to you if you want to share your screen. Great.
Thank you. Hopefully they're coming up. Something very slow is hopefully happening at the moment. So hopefully, yeah, fabulous. Great, thank you. Okay, as Emma says, I'm going to do a very whistle-stop tour of the National Cardiovascular Research Network. So we were funded in April 2025. We had existed briefly for a little while before, but we got sustainability funding from Health and Care Research Wales, plus some funding from the British Heart Foundation. So we're a cross-organisational network, and we're working to develop focused translational research capability to improve the prevention, diagnosis and treatment of cardiovascular disease for the Welsh population and beyond. So the network itself is made up of 6 universities, we've got 10 health boards and trusts, and over 20 affiliated institutions. And also we've got hundreds of individual members who are part of the network. Now our research is very broad, so it includes from the basic biomedical sort of research through clinical and population and public health. So as we are a network, we're very keen on building collaborations between all the different groups. So we've got the multidisciplinary expertise through the academic researchers, and we want to connect them to sort of the clinicians and the other healthcare professionals that have been involved in research and keen to be involved in research, and the healthcare providers. But really importantly as well, we want to make sure we're really connected to the patients and public within Wales so that their voice is heard in how we can improve both prevention of cardiovascular disease and treatment and outcomes for them. And whilst we are the sort of Welsh network, we are also very keen on connecting with the all the nations, and also global partners as well. to increase our strength and sort of capabilities. Now, we've got a couple of themes that we focused our work on, and these are areas where we've already got strength and expertise within Wales. And they are tackling arrhythmias and myocardial disease, and we've also got vascular ageing and clinical outcome. Now they're led by Prof Chris George from Swansea University and Prof Barry McDonald, Cardiff Metropolitan University, and they are the co-directors as well of the network. Now, underlying that, we've got another theme that sort of, as we've already mentioned, the SaIL Data Bank, which is part funded by HCRW. So there's a whole wealth of expertise there and other expertise within Wales around this area. And so we've got an underlying theme of data and advanced analytics. So part of the funding we received last year has actually helped us to develop the network further, and that means that we're able to offer more to our members. And a really key development for us has been the funding to allow us to build an operations team. And these are the beating heart really of the network. And so they're based at Cardiff Met and Swansea University, but they're available to all of us within the network. And so we've got 2 bid development officers who are there to support the development of high quality research applications to major funding streams, and also help provide tailored guidance for the proposal development, and importantly facilitate those connections, be it between health services, charities and universities. We've also very luckily been funded a data analyst who I'll speak a little bit more about later. We've got a comms and engagement officer who can help us with developing communication strategies and targeted outreach to audiences, which is really important for sort of getting the work that's being done within Wales out to our patients and public. And we've also got 2 project officers who help with the website development and all those other really essential keys to keeping an organisation going smoothly. So what have we been doing since April? We've had a couple of events. So the particularly big one we had was Connect and Collaborate event in December last year at Cardiff Museum, and that was to try and bring together a whole range of researchers, clinicians, healthcare professionals, R&D members and from businesses together to sort of introduce the network to them and also start that connection and building. The network itself is led on a Wales-wide consortium bid, and the advantage of having that network meant that we were able to sort of connect to the wealth of expertise within Wales and bring the relevant people together quickly for a relatively quick response to this challenge. And also in response to the changing way that funding is going with these big challenges, such as put up by the BHF on the AI and cardiovascular disease, we can bring together the people who are connected to the network to Sandpit events. We have one tomorrow, that we can help look at how we can strengthen our responses to the new sort of outlook on the funding landscape. In addition, we're keen to try and bring those who aren't so much into research, or there have been various barriers to participating in sort of research. And so at times our healthcare professionals have certainly been meeting barriers or have not been encouraged to be in research so much. So we're trying to develop events to connect with those. Then finally, we've been capacity building. So we recently advertised some fellowship applications with the NCRN, and the recruitment process is ongoing with those, but we hope in the not too distant future to be able to announce some new potential exciting researchers who will potentially be our sort of new leaders in years to come. So we're hoping to have around 4 fellows in sort of split between Cardiff Metropolitan and Swansea universities. In addition, we do have, which is a bit unusual for some of the networks, some small pots of money to provide funding. And probably one of the most important of these is our Aurora Fund, and that is an opportunity for a wide range of organisations, be it community groups, charities, schools and universities, to apply for some of this funding to help sort of try and help reach those people who are not engaged in cardiovascular research or research at all, but they may actually be disproportionately affected by the disease, and to try and understand what their needs are and how we can incorporate them into research. We've then got a couple of other sort of funds that are a little bit more researcher directed. This is the Research Responsive Fund and the Secure Data Access Catalytic Fund, and this provides sort of small pots of money to help provide that option for you to do that extra bit of work or build those collaborations that will help strengthen your research bid and make it more likely to receive funding. And the intention there is to put the funding towards sort of things like the BHF or NIHR. So as today is very data focused, a little word on our data and advanced analytics theme. So that's led by myself and Dr Renan Toms from Cardiff Metropolitan. And as I say, we have also got a data analyst, Laura Herbert, who joined us in October. And she has got a wealth of sale experience. So she's a real asset to us and helping us develop the theme. So what we're hoping to do in the next few years is we're really keen to support the development of cardiovascular disease research using big data within Wales. We're really keen to get those people on board who may never have thought of using this data and help sort of guide them through the pathway to be able to use the data to answer the research questions. We're very keen on enhancing the use of sort of cardiovascular data sets and making them more understandable, making people understand much more what data is there that's relevant to cardiovascular disease research. Also very keen to facilitate bringing in new cardiovascular related data sets to sale. That might be reports from imaging, sort of clinical imaging, which can really enhance the data that's already available and add much more nuance to that data and improve sort of the diagnostic capability of the groups that we are looking at. Also, as part like the taking part in the event today, building collaborations to drive data science innovations. So that's working with HDR Wales and looking to build with people like the BHF Data Science Centre. And then we also want to respond to the research community. So we're really keen that people do get in touch with us to let us know where they might be interested in research, what barriers they may face, what problems, so that we can understand how we might be able to help with that, what information we can provide, and where we should be sort of guiding our efforts. So that was very much all the big data, but we are also aware that people, sort of basic scientists, may also be developing websites full of large numbers of data. And Dr Nicole Sullo, who is very much a specialist in this, has also got an advanced data analytics component as part of the NCRN. And here she can help to provide a service where she can bring together sort of data, help people bring their data together, link their data, clean their data, and do the more advanced techniques, and to help develop collaborations between other groups of people to enhance the work that has already been ongoing with that. So that is a very quick tour within the time frame, but if you do want to become a member, you can scan this QR code, or there's the web link on the next slide to find out more about us and what we're doing and to ask any questions. So thank you very much.
That's great. Thanks, Libby. Really nice to hear about some of the small pots of funding. I think as a researcher in this field, sometimes it's really hard to get going on something new from a clinical environment. So having a little pot of money potentially to test something before going for a bigger grant is super, super helpful. So I'm guessing all of the details of those grants are online on the NCRN website. If people want to go and have a look at those, that's great.
I'm just gonna if you're interested in imaging, I'm just gonna say the next connecting expertise talk is on imaging and trying to bring expertise together on imaging. I've just put the link in there, so if anybody is interested in meeting people more on the imaging end of things and how to analyze images, the next talk is on that next month. So the link's in there if you want to have a wee look.
So thanks very much, everyone, for attending, and hopefully see you at another one of these events soon.